Does your child really struggle with going to the doctor's office? Are you parenting a child with unique needs, a child who is neurodiverse? If you answered yes to these questions, then you are in the right place. Welcome. My name is Crystal Sanford, and I am your host today for our Lunch and Learn for neurodiverse families. Our topic today is coping skills for kids in stressful situations. And going to the doctor's office could be one of those. I'm so happy to have our special guest today, expert in this area, Alyssa Pettingill. Hi, Alyssa.
Hi, Crystal. Thank you for having me today.
Oh, thank you. Thank you for sharing your time. And I'm very excited to hear more about what you have to share for our families.
Of
So,
course.
yeah. So, families, thank you again for joining our Lunch and Learn for neurodiverse families. Again, I'm Crystal Sanford, your host, a special education advocate, speech pathologist, and autism mom, like several and many, maybe of you who are watching today. Please know that the information that is shared today is for your informational purposes only. If you are looking for legal or medical advice, we encourage you to contact a professional in that area. And then lastly, know that our show is sponsored by the Sanford Autism Advocacy Group. We help families advocate for the education that your child deserves. So, again, our topic today is coping skills for kids in stressful situations. And Alyssa is an expert in this area. Alyssa, let us know a little bit and let the audience know a little bit about what brought you to this field to be a child life specialist. Um,
Yes.
and we always value story, and so we would love to hear a little bit more about your story. And families who are watching us live, always know that you can ask questions today of Alyssa and myself by just typing that into the comment section. So thank you for those who are joining us live. Feel free to type that, and we'll do our best to answer those questions today. But I'm going to let Alyssa take it away.
Thank you, Crystal. So, in terms of how I got started and how I learned about this field, I, one, always knew I wanted to work with children. I've been working with them since I was 15 years old. And so I went to actually I majored in child development at San Diego State. And I learned about child life in the process of getting my degree. And from there, I started working in the pediatric hospital setting. I worked at Stanford Lucille Packard Children's Hospital for several years, and then I transitioned to NYU Langone during the pandemic. So I was in New York during that time. And from working in both inpatient and outpatient specialties, I really found that there was a large gap in the emotional support families were receiving in the hospital or in the clinic versus when they went home. Some families would learn all about a new diagnosis from, their doctor, the nurse practitioner, other team members, and they would go home, start to process, and then have so many questions or concerns. And my role as a child life specialist is to make sure that one, the child who has the diagnosis understands what's going on in their body. And then also making sure, how are they coping with this new information? And do they have the right education? Are they feeling prepared for upcoming procedures? Do their siblings understand what is going on? And then also helping the parents, should they decide they want to have those conversations with their children, do they feel like they have the language they need to do that? So really in that time period, especially during the pandemic, I found that families were having a lot of needs when they went home after these visits. They were still either processing the diagnosis and needed some more time before I jumped in to help. Or we would see them for, it'd probably be like sometimes 4 to 6 months, where they would go home and be on their own. And then they'd come back and they'd have so much to share with me about all the struggles they've been having with their child, whether it's like misconceptions their child was having, compliance issues with maybe medication taking, a lot of different things going on. So I found from that, we really need to be providing this emotional support at home and in the
Mhm.
community, so that families feel like they have someone to call and help them navigate these struggles. And that way their child and themselves as parents can feel empowered and feel just able to cope more effectively with everything that's going on.
Well, that is really great. Before I met you and we connected, I had never heard of a child life specialist. So, and I've come to know that there are only a few of you, especially in the Southern California area. So, if you can maybe let families know a little bit more about what is a child life specialist.
Yes. So a child life specialist typically has an extensive background in child development. So that's why I got both of my degrees in child development, both my bachelor's and my master's. And then we also take specific coursework around grief and bereavement, what it's like for the experience of a hospitalized child. So between those two things, we have a great understanding of what a child understands at each developmental stage. And then we also understand the medical experience in and out. And beyond the medical experience, children go through a lot of transitions that are very similar to having an acute or chronic illness, such as if they're going through a difficult transition such as a divorce. They're
Mm,
still feeling that sense of loss like they would when they are going into the hospital a lot. We have different feelings of grief,
mhm.
but there's a lot of parallels with that, as you can imagine, right? So
Yeah.
there's that feeling of like loss of routine and structure,
Mhm,
the
mhm,
loss of, your typical family unit, loss of time with friends. I am helping children navigate different medical challenges, but also difficult life events. So, like I mentioned, yeah, a child going through a divorce, maybe the loss of a loved one, which could be a
mhm.
loss of a pet, a loss of a sibling,
All
loss
right.
of a grandparent. Um, and medical challenges that we help with can vary as well. A child doesn't have to be diagnosed with a particular illness. They could have a life-threatening food allergy, and maybe they need help
Mm,
understanding what does an EpiPen do, and what is
yeah.
anaphylaxis. Maybe they have just a difficult time each year when they have to get vaccinations, or maybe they require injections for their asthma. So, as a child life specialist, I can help them with needle phobia.
Mm,
And I do that by developing coping plans with them and their parent so that they feel like they have the tools they need when they're in that clinic setting. Um, and we can talk a little bit more about that if that's of particular interest. So to wrap it up, as a child life specialist, I help children and teens and families develop coping skills so they can navigate various medical challenges and life events.
wow, that's really a powerful space to be in and a way to help families. I think maybe one that a lot of families aren't even aware of, like I wasn't. And knowing that there is someone who can help as a guide along that journey and beyond just the parent. Because sometimes in things like this, the parent is so involved in maybe the medical care or the talking to doctors and all that, that maybe they don't have the bandwidth to be able to also help the child emotionally navigate all these things. They're just trying to keep the child alive. Maybe it could be, like if it's EpiPen or something like that. So, yeah, to know that there's someone who can help support families in that area is pretty cool. So I'm excited and thank you for stepping into that space.
Absolutely, Crystal. And to add to that, I mean, we have seen for such a long period of time that children are kind of viewed as passive participants in their medical
Mhm,
care.
mhm,
And our role is to really help them feel like they can advocate for themselves, And I have seen just, how resilient children are. And from the time I start working with them to, weeks or months down the line, I find they're total experts in their
Yeah.
body,
Awesome.
what works, what doesn't. They're telling nurses how to do their dressing changes or what works for IV placements. It's really
Mhm.
quite amazing if you're able to initiate that intervention early on.
That is so awesome. And that really makes me think about our company specifically this year. We're taking on the idea of strength based IEPs and
Mm.
um, kids having a more active role and families, of course, as well in a child's education and a child being able to know what their goals are, know, and share with teams what works, what strengths, what are weaknesses. And so sounds very similar that a kid being able to have a voice in their medical care. That sounds amazing. Who wouldn't want that, right? That's wonderful.
Absolutely.
Yeah.
Absolutely. 'Cause
S- Go ahead.
Oh, and I was actually going to add, because child life specialists have an extensive background in child development, we are very much, everything is individualized, and we use therapeutic play. We use bibliotherapy, which is, using books in a
Mm,
therapeutic way, and self expressive activities. So, we use those things because we're gearing it towards where that child is
mhm,
cognitively and
mhm.
socially, emotionally. So it's not that we're just talking at children and letting them know, like, here's what you should ask your doctor next time you're there, or here's the kinds of things that you should know right off the bat about your body.
Mhm,
The idea is to be able to teach kids as young as 2 and 3 in ways that they can understand. And we know behavior is their first language, and we know
mhm,
play is their work.
mhm.
So we're always tailoring our interventions and using various tools to educate and to learn from these kids and what they're thinking and what's going on.
Yeah, thank you. That's so awesome to kind of for parents to hear kind of the how tos. And I'm going to take this and add this to behavior is their first language. I love that.
Mhm.
And play is their work. Wow.
Absolutely.
I love that. And that's so true. I mean, developmentally, that is so true. But I think sometimes teams miss that. IEP teams miss that. Doctors, maybe sometimes as parents, we miss that. And specifically thinking about behavior, if a child's engaging in behaviors, what does that mean? That has a reason, that there's something they're trying to communicate. As an SLP, that's always my thought is whatever you're seeing the child do or demonstrate, that's a way of communication. It's not always words. Sometimes it's eye gaze, sometimes it's behavior. So, yeah, I love that.
Absolutely.
Yeah, behavior is their first language and play is their work. So I'm adding that. And families, again, if you're just joining us, welcome to our Lunch and Learn for Neurodiverse Families. I'm your host, Crystal Sanford of the Sanford Autism Advocacy Group. And we have the pleasure of having Alyssa Pettingill here today of Empowering Kids LLC. Alyssa has the honor of supporting families through stressful situations, and that can include doctor's visits, navigating medical diagnoses, also the loss of a pet or a loved one, as well as divorce, any types of stressful situations that a child might incur or encounter. Alyssa can support the child and the family through that. So I'm so excited to have you here and sharing. Alyssa, I wanted to ask, what specifically is your work in supporting the neurodiverse community? And I just think about, the majority of our families that we are serving have an autistic child or young adult. And so it could be that they also have a comorbidity. And like for my daughter, she also has asthma. For some
Mhm.
kiddos, it may be that they have other issues that require them to, or even just the idea of going to the doctor for a kid on the spectrum can be a thing. I remember when my daughter was younger, just getting her blood pressure taken was, impossible. Or, a
Mhm.
needle. Even now, a needle takes two of us to be there to have kind of help her and stuff. So, yeah, let us know how you help the neurodiverse community.
Yeah, and, I totally understand, Crystal. I mean, there's parents, right? As adults, some
Sure.
immediately
Yep.
faint when they
Yep.
see, blood or
Yep.
hear that they have to do blood work.
Exactly.
So, it is not just the neurodiverse community that struggles with these things,
Hmm.
but in terms of how I support that community and those clients specifically, a lot of it is creating coping plans. Like you,
Hmm.
mentioned, there's a lot of different things that families could be navigating, but if it's creating a coping plan for a kiddo with autism for their annual doctor's visit, I may utilize a social story,
Hmm.
and have specific pictures of that clinic so they know exactly what the steps are.
Oh.
I also help with desensitization, because, like you mentioned with your daughter, I had a patient that had severe asthma and he required monthly injections.
Mhm.
And what we did was we made sure that at home, his parents were, since I wasn't working in the community yet, we were
Mhm.
giving tools to his parents to help with desensitization. We
Okay.
were giving them, what do they call them? Tester, or
Mm.
expired,
Okay.
injections so that
Mhm.
they can actually, so that the child could feel what it would feel like without
Mm.
the needle,
Okay.
um, and utilize comfort positioning, which
Mm.
is, what makes him feel most comfortable. Is it sitting on dad's lap, with dad's arms around him?
Mhm.
Is it, and also thinking about, where is the best site for him? Is it behind his arm? Is it where his leg
Mm.
is? Where is he gonna maybe feel less, not triggered, but, in a
Mm.
like, maybe out of sight, out of mind is what we
Mhm.
find a lot is really helpful,
Mm.
in the back of the arm for
Mhm.
a child with sensory sensitivities, so that way they're not seeing it and becoming more anxious as it's
Mm.
happening.
Okay.
Um, so it's a lot of coping plan development, and doing role rehearsal. So
Mhm.
that goes, right in line with desensitization,
Yep.
and talking with families a lot about, because I know the hospital and medical and clinic experience so well, letting them know, okay, here's are the steps that you're probably going to go through. Now,
Mhm.
which aspects of this is the most, what are the biggest stressors for your child? Because when I get a parent thinking about the biggest stressors, then we're starting to think about, okay, what kinds of questions do we need to ask before the appointment?
Mhm.
Um, is my child going to have to remove parts of their clothing? That's going to be a problem for them.
Mhm.
Or, I've had many kids with sensory, sensitivities and those with autism, because of issues with constipation, require rectal exams. And
Yes. Yep.
those can be very traumatic for children. So we need to have that time and space to talk about them beforehand. And so I'm doing a lot of directed and child led medical play, to
Mhm.
help with preparation and coping skill development.
Oh, wow. I really like that play, getting the child into that space to some degree so that you can talk through what it feels like to sit with those feelings and so they can all and know what's going to happen next too. Because when you think about kiddos and the individuals in the spectrum in general, right? A lot of times they struggle with reading the room. They struggle with knowing what's coming next,
Yeah.
just because their brains just aren't wired to pick that up naturally from the environment. So whatever we can do to pre-plan and share and front load that information, I think can be super supportive. So that's great that you do that.
Yeah, and doing it in a non-threatening environment.
Mhm.
And that's what's so great about working in the community now. By being able to practice these things at home when children are feeling calm, when they're in an environment that they know really well, we're able to make that experience less threatening. And
Mhm.
so then when they do go into that newer environment, as if they have those, go-to people, and
Mhm.
I was going to mention this near the end. I also can go to appointments with families.
Oh,
I am very
wow.
open to doing that. Of
Mhm.
course, my number one goal is to empower them so they feel like they can advocate for their child. But there are those circumstances where it's helpful to have two people, like you mentioned.
Mhm.
So maybe moms, right at the front talking with their child, and
Mhm.
maybe I'm the one that's talking them through the steps and reminding them, okay, first we're going to do
Mm.
this. then we're going to do that.
Yeah.
And mom's that primary emotional support, or dad, or whoever it may be. So yes, I do strongly believe like being able to work on this at home, it
Mhm.
just makes that transition to the medical setting so much easier and much more of a positive experience for all parties.
That's great. That's what we want, right? We don't want to trauma like I think we talked about before. Today's show is PTSD, right? Some kids have PTSD about going to the doctor's office or the dentist, or um, maybe even if you're thinking about like divorce as a situation, maybe going back to the home or going to
Mhm.
the other parent's home if they've split up. Um, just could be for a variety of reasons, right? So, talking through things, preparing, having conversations, and setting that stage ahead of time can be super powerful. So, what two tips do you have for parents today? I always want families to be able to leave with actionable steps. So, if a parent here has a kiddo, neurodiverse kiddo, who is struggling with, either it's doctor's appointments or it's, could be additional medical conditions or some stressful situation, what are two things that parents can do to support their child?
Yes. So I touched on it briefly, but I do think, when you're considering the appointment, maybe it's a specialty appointment, or you found out your child requires a procedure, maybe it's a one-time procedure, or whatever it may be. Consider what you know most about your child and what their stressors may be. So if your child really has difficulty, um, with someone touching them that's unfamiliar, or maybe they have a really hard time doing anything related to blood draws or anything with needles, think about what is the biggest comfort to your child in those moments. What can we do to support them? What's their biggest, their novelty distraction item that helps them with these kinds of things? Is that maybe something you can bring with you from home? um, and then in relation to anything procedural, whether it may be a blood draw, IV placement, maybe it's a dressing change of some kind, or even a cast removal or stitches, um, comfort positioning is absolutely key. If that's all you remember from today, this is your big takeaway. Um, and since I'm only one person, I can't demonstrate all the great comfort positions. But if you check out my blog, Comfort Positioning, under coping skills on my website, empoweringkids.com, once again, that's comfort positioning under coping skills, you will find images of two different comfort positions, and then a few others that are detailed, that go over how you can hold your child in a safe and secure way while also being able to provide the emotional support that they need. Now, this is something a lot of even pediatric clinics and hospitals don't think about when they're getting ready to do a procedure on your child. But it's really important for you to know these different types of comfort positions, because it's going to make a world of difference in helping your child feel more comfortable because they have you close to them. They're going to feel like they can, what was I thinking? They're going to feel more safe and more comfortable. They're also going to be more compliant because you're still having a firm hold on your child, but you're not forcing them down. You're not trying to burrito blanket them. You're not applying pressure on them or having unfamiliar people holding them down. All of these things are not ways to make your child feel safe. So, to kind of briefly describe one primary comfort position that can be used for kids as young as 7 and as old as, 15, 16. Basically, you have your child sitting on your lap. You have your arms crossed over them so that their arms are secure. And if they require a blood draw, one arm is left out for the
Mhm.
nurse to hold. And then you put both feet around your child's feet and kind of crisscross applesauce. So that way your
Mm.
child's legs are also secured. And
Mhm.
that's a way for you to still be able to talk in their ear, provide that soothing support that they need, be that one voice, like we mentioned earlier. Like
Mhm.
it's really important for you to be able to, for your child to hear your voice when they're in stressful situations. And then it also allows the nurses and other medical providers to be able to do their job and do it successfully, because we really want that to happen on that first time with whatever they may be
Oh
doing.
boy. Oh, for sure. Oh, heaven forbid they have to be poking more than one time. You can forget
Yes,
it, right?
I know.
And I think about some of this, it's not even just neurodiverse kids, like you said, there's neurotypical kids. I mean, I have an adopted sister. She is 22. And I think my adopted brother, same thing. They hate needles. They will not. I mean, my brother almost passed out, and my sister is like, "Well, she just refused." So panicky about needles. So I mean, I know adults who struggle and neurotypical as well as neurodiverse. So anything that we can do to support the situation and free up the professionals to do what they need to do, right? Because that's what I can think of too. In the past, thinking about my brother when he was little, it took 3 people to draw blood from him when he was like a
Mm,
little guy. But these are nurses, like these aren't people, you know what I'm saying? Like I like the idea that you said that a parent being able to be the comfort person and being in their ear so that the professionals can do their job. And
yeah.
so I really like that. And thank you for sharing that. So
And to
parent,
practice at home. It's important to practice these before you
yes,
go, just like as
yes,
part of the key part of preparation, so
I
that
love
your
that.
child knows what it looks like.
Mhm.
And they're not surprised or taken aback when you implement that comfort hold with them.
I love that. I love that. Preparing and role playing and practicing until it becomes okay. It becomes a normal thing
Mhm.
that your child will expect. They'll know what the expectation is, and you'll see more compliance and move through that in a timely manner. Right. So
Yes, yeah,
that's
and
so
no more
great.
holding down. That is
No
not
more
helpful
holding
for
down,
anyone, and
please. Oh my.
that leads to PTSD, like you said,
Right. Oh my
and
gosh.
there is actually a term for PTSD, but in the medical setting, it's pediatric medical traumatic stress. So
Wow.
that's
Okay.
PMTS, and that was coined in
Mm,
2003.
wow.
So it really does go to show that
Hmm.
children and parents are greatly impacted by negative medical experiences.
Hmm.
So it's
Hmm.
important we prepare, educate, and help them feel empowered.
That's so great. We've talked about so many things here today, and families, as you're who are watching live, feel free to add your questions or comments to the comment section as we're wrapping up. But with Alyssa here, child life specialist, we've talked about, behavior is a child's first language, and play is their work. And so using play, identifying behaviors, giving them support in preparation for procedures through play, especially for little guys, doing comfort positioning and even practicing that. That can be used, even up through teens. And also, I wanted to just ask, what about for the family, Alyssa? This is always my question. What about for the family who says this can't work? I'm sorry, we've tried it. My kid, it's too late. They already have this pediatric, stress. What do you say to that family?
Well, it is such a great question. But I think parents forget, right, that they know their children best. They are total experts. They know how they learn, what calms them, what stressors can trigger, feelings of anxiety or behavioral outbursts like we mentioned earlier. I'm simply a professional that works with them to build upon the skills that their child already has, and I'm helping them better understand the medical environment.
Mhm.
Parents don't have to be medical experts to help their child through these difficult times, but we're working together. So you have to remind yourself, you know your child best. And also the good news is that I'm the type of professional that can be utilized in stressful situations. So if you do have a medical appointment, or a surgery coming up, and hopefully those pandemic visitor restrictions have been lifted everywhere by now,
Mhm. Mhm.
but I can come along with you if you're feeling like you need that second emotional support for either yourself or your child. I'm here to, decrease that stress and anxiety and remind you that you can do this, and you are your child's just biggest, emotional support and tool to help them get through things.
Oh, that's so great. So you're not alone, families. And if you feel like this is just maybe something, you're too far gone, or your kiddo is now, had such experiences that and maybe it's just too hard that they'll never be able to get through those things. You know, Alyssa is saying she can help and there is support. And I will say the same thing as a parent of a child who's now 12 and a half on the spectrum. I can think back to the days when, my daughter, just was terrified of the blood pressure cup, or, needles, or sitting with her head lower, kind of hanging at the dentist office, that,
Mm,
leaning back for that. And now she can do all of those things. And
amazing.
so, there is hope. There is hope, families. And as you work with a professional like Alyssa, or learn some of the strategies from her website or blog, you'll be able to see that as well for your child. So, Alyssa, how can parents contact you if they want to learn more?
Yeah, they can visit my website, empoweringkidswithaz.com. So that's a Z instead of an S for kids. And like Crystal mentioned, I do have a blog on there that covers several different topics. Or you can reach out to me on my business telephone number, and that is 916-402-3384. So I have a little contact box on my website, or you can feel free to call me directly. And I'd love to hear from you and about what's going on in your child's life right now, or your life, current stressors, and how I can help you guys navigate those various hurdles.
Awesome, awesome, family. So if you're navigating, if you're parenting a neurodiverse child and navigating maybe a secondary diagnosis, with requiring maybe medical procedures, or it could be, like you said, constipation, big thing for a lot of autism families.
Yeah.
Could be, navigating that. It could even be a stressful situation like the loss of a pet or a loved one, or a divorce. If you're having any of those stressful situations, then Alyssa at empoweringkids.com is the
Mhm.
person to contact. So thank you so much, Alyssa, for sharing with us today.
Yes, and Crystal, I will add, because I'm sure neurodiverse kiddos and teens have to deal with this eventually. Is I do teach pill swallowing, so I
Oh,
know that
awesome.
is a big one too for
Mhm.
families. So
Oh yeah. Oh
yeah.
yeah, for sure. All right. So you are the go-to person for these things. Where were you years ago? I don't know.
No.
Oh, but so glad to meet you and share this resource, this child life specialist expertise with families today. So thank you again, Alyssa.
Yes, absolutely. Thank you for having me, Crystal. And, as a reminder, I provide in-home services. So I come to you. No need to bring your child to another clinical type setting. That's just going to cause them more stress.
Oh, that's so great. Oh, wonderful, family. So Alyssa is ready and able to support you in the home, even all the way through attending these appointments with you, which is a great resource, as she empowers kids and empowers families. So thank you again, families, for joining us on another episode of Lunch and Learn for Neurodiverse Families. Our topic today has been coping skills for kids in stressful situations. And our goal is that you are leaving here with insight and empowerment and hope. Have a wonderful day.